Have you ever wondered why so many people have poorly controlled blood pressure in spite of their doctor's recommendation to restrict salt and take their blood pressure medicine? Hi, I'm Dr. Hampton, a board certified family and obesity medicine doctor with a master's in nutrition and functional medicine. And I'm on a mission to help you achieve metabolic health. And today I want to give you the secret to healing from and reversing your high blood pressure. And so, if you know anybody who is suffering from high blood pressure and you want them to heal from it, share this video right now. Pause the video, share the video so that they'll know the secret to reversing high blood pressure. But before we get started, let's talk about the facts, right? The facts are striking. And this is from the American Heart Association in terms of what is a high blood pressure in the first place? And in 2017, the American College of Cardiology, they actually made a suggestion that we should lower the standard in terms of, you can argue increase the standard, but bottom line is that a blood pressure over 130/80 is considered high blood pressure. Stage 2 is 140/90, which is what the old recommendation was. So that if your blood pressure is not less than 120/80, you are considered a high, at risk for elevated blood pressure or hypertension, which is pretty striking since so many people fit into this category. And speaking of category of people who fit into it, if you look at this image of the country, you'll notice that in states like California and maybe over in Massachusetts and Connecticut out east, you have a low incidence, but you'll also notice that in certain places, the incidence is much higher. For example, my wife's from Mississippi, high incidence there. Louisiana, I went to school in New Orleans, and Arkansas are places where the incidence is much higher. My family's from Arkansas, so the first three states I mentioned are places where the incidence is pretty high. Oklahoma, Texas, Kentucky, and other southern states like Tennessee, Alabama, and Georgia are also included. So the southern states seem to be greatly impacted. Now, when it comes to deaths, 670,000 deaths in the United States from hypertension or it contributed to its cause, and that's in 2020. But the real thing that caught my attention is that nearly half of the adults in the United States have 47% have hypertension, which is really striking. So if somebody you know or love, if it's not you, has an issue with hypertension. So let's look at what the American Heart Association says we should focus on as it relates to hypertension. So what they're asking us to do, guys, is simply reduce the sodium or salt in our diet. So that's their basic recommendation. And of course, they want us to take our medicines if we qualify. And their recommendation for salt would be around 2,300 milligrams a day of sodium. And if you have an issue with your blood pressure, probably in more in the 1,500 milligrams per day range. So that's kind of what they're focused on. And so if you think about it, the current model is focused on reducing sodium as well as making sure you take medicine, which is a great way to manage your high blood pressure problem. But if you really want to reverse your hypertension, we have to get to the root cause of why you have a high blood pressure in the first place. So this video, that's the purpose of this video, is to get to the root cause. Now we're going to start with this graph because this graph really provides an overview of the important concepts I want you to learn in this video, starting with overnutrition, right? So we're going to start there. And the question is, what do I mean by overnutrition? There's only 3 macronutrients that we think about, and those are the carbs, protein, and fat. So the goal is, if we are to prevent too much insulin being made or hyperinsulinemia, we have to reduce the macronutrient that will make that occur. And as you can see from this graph, it's clear that the carbohydrates will raise your blood sugar higher than protein, and fat barely raises it at all. So a logical person would say, well, let me reduce the macronutrient that raises my blood sugar, therefore leading to hyperglycemia. Let's take it a step further. Let's get a couple of examples in front of you. So let's think about brown rice, for example. And let's do the math. So the equation is very simple. Carbs divided by 4 estimates the teaspoons of sugar. So as you can see, even brown rice that many people think are a perfect side, 45 carbs. If you do the math, that's 11 teaspoons of sugar. That's 45 divided by 4. Imagine a potato, which is 37 carbs. That'll be just about 9 teaspoons of sugar if you do the math. And of course, a banana. Everybody needs their potassium, right? So they're eating bananas. But if you have issues around metabolic syndrome, risk for diabetes, risk for high blood pressure, maybe a banana is not the best way to start. And the ironic part is that potassium is good for your blood pressure, but maybe this is not the best source. 27 divided by 4, approximately just under 7 teaspoons of sugar. And then the last example I want to give you is Raisin Bran. And most cereal are just sugar, but this example is 46 carbs. If you do the math, 12 teaspoons of sugar in one serving, 1 cup of Raisin Bran. So now you understand why your nutrition is important. Let's go to the next talking point, which is your genetic predisposition. Yes, it's true that some of us are salt sensitive. And here's a study talking about the different tools we can use to determine if we're salt sensitive. In this review, it talked about how your salt sensitivity is best determined by measuring the blood pressure response to chronic changes in oral salt intake. So in other words, if you're eating a lot of salt for a little bit and your blood pressure goes up, you may be salt sensitive. So that's a very practical way to do it. They also have these markers you can test for that'll tell you if you're likely to be salt sensitive. The one that they really focus on is the one called the GRK4. Which has been shown to be associated with salt sensitivity. So again, I don't think you need to run and focus on whether you're salt sensitive or not, because my clinical experience has been that when people change their diet, a lot of times it fixes the problem anyway. So I would focus on the nutrition portion first. So let's go to the rest of this graph. So as you can see, rather it's overnutrition, genetic predisposition, and high dose insulin. How ironic is that? So for some people who are on high dose insulin, that's going to lead to hyperinsulinemia, and that'll then lead to too much calcium going into the smooth muscle, leads into constriction of the muscle. Carbohydrates have hydrate in the word, so water and salt go into your body when you consume carbohydrates. So your absorption of salt is going to be greater with certain types of diets that lead to hyperinsulinemia. Your endothelial cells are the lining around your arteries, and if they're dysfunctional, that can increase your risk for hypertension because they can get stiff and irritated, primarily because you don't make as much. That ENOS is endothelial nitric oxide, and if you don't make that, which is made in those endothelial cells, then you're going to have constriction. And of course, macrophages come wherever there's inflammation. A lot of starchy, sugary foods lead to inflammation, and then that can lead to hypertension. Lesions occur because of the inflammation, leading to heart disease. And as you can also see from this graph, hyperinsulinemia leads to insulin resistance. The insulin's not working very well, and therefore you are not going to have the nitric oxide. Think of nitric oxide as what you give people when they're having chest pain and it opens up their arteries, just for reference. So now let's think about the recommended diets that are out there in the media. You've heard these recommendations in the past. U.S. News is technically a independent organization that provides their best and worst diets, and a lot of people, your doctor may be following this, your nutrition professional may be following it, but let's just take a look at it. And they rank your diets, right? So based on the 2022 diets that they ranked, of the diets ranked, Mediterranean diet, they considered number one, and that was for the 4th year in a row. But look at this, the diet that I tend to recommend to my patients, the ketogenic diet, was ranked at 37, towards the bottom of the list. So let's take a moment and pause and see if this makes sense. So let's start with the Mediterranean diet. This is the one I'm going to focus on since it's the best diet based on these recommendations from U.S. News and World Report. And this diet, as you know, is for people, people in the Mediterranean area, France, Spain, Greece, Italy. Those folk are the ones who tend to have that type of diet. Let's kind of get a sense of this diet. Does this diet really help you avoid that high carb surge, that those high carb foods that then lead to insulinemia, let's take a peek. So let's start with what the recommended diet looks like. They say you should eat more vegetables. I'm good with that as long as they're not starchy. Fruit. I gave you the example of a banana. Fruit will raise your blood sugar. So maybe fruit would not be a recommendation I would go with. I'm okay with nuts and seeds as long as you're not, going to overconsume those. And many people do. So you have to be careful. Legumes and things like beans and stuff, those tend to be starchy. So I'm a little hesitant to recommend that. And potatoes, of course, are starchy. Grains are starchy. So when I look at this list, I don't have a problem with it in theory. But if I have a person who's trying to avoid hyperinsulinemia, a lot of the things in that section are suspect, and it may actually raise the blood sugar in a person who's insulin resistant. And then when you go down to, I have no problem with poultry, eggs, cheese, and yogurt. I think I would eat those in the eat category, not eat in moderation. As long as my yogurt, it has to be a full fat, low fat yogurts tend to add sugar. And what I would definitely disagree with is this idea that red meat should rarely be consumed, right? And that's one of the main staples of a low carb or keto diet. So I disagree with that. And I pretty much, think it's okay to avoid many of the other things listed. So when it comes to vegetables, most vegetables are not starchy, not sugar, will not cause that spike, but potatoes and sweet potatoes certainly will. So I would not have that on my list, although the Mediterranean diet does. When it comes to fruit, fruit is nature's candy. Most fruit will spike your blood sugar, other than berries, and you have to have those in moderation. I do not think a diabetic should be consuming a ton of fruit. And when it comes to nuts and seeds and nut butters, again, as long as you're not overly consuming those things, you're doing it in moderation, I think that's okay. So again, like legumes, I think I would be cautious of. Whole grains, I think I would be cautious of. You saw what the rice did in the previous slide. And then, of course, I would eat plenty of fish and seafood as well. Anything that's from the animal kingdom will not raise your blood sugar. If it's dairy, you want to focus on full fat, not low fat. And so otherwise, I think the Mediterranean is okay. Now let's get to the keto diet. This diet is high in fat, which doesn't raise your sugar. Remember that initial graph. And it's low carb, and we don't want the carbs, right? So for a person who doesn't want hyperinsulinemia, that sounds like that's the jackpot. And what I love about this diet is that it relies on fat burning. And if you rely on burning ketones, which is a type of fat, versus carbs, that's going to keep you stable. You're not having those hyperinsulinemic moments, and you're going to do much better with that approach. So the good thing about the U.S. News and World Report is that they attempted to get the expert opinion of dietitians, docs, researchers as part of their panel. So they had the expertise in theory. They were fair. They were technically independent of U.S. News. They had diverse viewpoints, and it was nice representation. So that's absolutely true. And with those differing viewpoints, where some were plant-based and some were low carb based, as an example, that should in theory give you a report that's reasonably fair. And in fact, some of the experts that were on the panel included Dr. Mark Cucuzella. I know him personally. He's a great guy. He's a low carb doc. Dr. Eric Westman at Duke, another guy I know very well, who's doing a great job. And then it has some plant-based folk like Dr. Michael Greger. So it did have that kind of variety of input, but the problem is these are expert opinion, right? And I think that when I make recommendations to my patients, I would prefer that recommendation come from science. And I think that the U.S. News and World Report fails to follow the science. So let's talk a little bit about why some people who were on that panel were afraid of the keto diet. And I think one of the fears was the fear of saturated fat. So the question is, should they fear saturated fat? Well, I think they shouldn't, because in 2020, there was a reassessment of the recommendation about saturated fat from the Journal of the College of Cardiology. And although the recommendation historically had been to reduce saturated fat to less than 10%, it is now clear based on a review of the science, a well-done review, by the way, that there is no robust evidence that our current population-wide arbitrary upper limits of saturated fat consumption in the U.S. Will prevent cardiovascular disease. So there's no need to limit saturated fat is what that's being translated into. But the recommendation to limit dietary saturated fat has persisted despite evidence to the contrary, which is why I'm making this video, because so many people, whether it's you as a patient or a clinical colleague of mine or a scientist, they haven't gotten the memo. My job is to get this information out here. And it also says that whole fat dairy, that's why I said low fat doesn't work. Meat, eggs, dark chocolate, we prefer meat to be unprocessed, but periodically that's not a big deal, are not associated with an increased risk of cardiovascular disease. So we have no reason to restrict that. So now the second reason I think that the people are very nervous about low carb and keto is because it's fear of LDL cholesterol rising on a keto diet. But keep in mind, the LDL cholesterol has both small and large particles, and I'll speak to that in a moment. Here's a study from Cardiovascular Diabetology. This study looked at, it was a randomized controlled trial, and it looked at including nutritional ketosis using that as a way to protect against cardiovascular risk factors and disease. And so what they did in this study is, let's put some folks in nutritional ketosis with a low carb or keto diet, and then let's just see what happens to their cardiovascular risk factors. And what they found is that when patients were in ketosis, most biomarkers of cardiovascular risk after a year actually improved. And they did mention that the increase in the LDL cholesterol appeared to only be limited to the large particle, and that's important. So let's distinguish between the larger and small particle. Most clinicians focus on LDL because it's a good way to predict heart attack risks in theory. But many people diagnosed with heart disease have LDL levels that aren't especially high. In fact, I did a video about LDL cholesterol. I'll put it in the show notes that explains that in more details. It turns out that the LDL particles are not all equal. Smaller, more tightly packed LDL has an easier time getting into your arteries, while the larger, fluffier particles may be less dangerous. So in other words, if we just look at the LDL that they measure in the office, and that's all we look at, we don't even know if it's small or large. So you need to start telling your clinician, can I get the particle sizes? Make sure it's covered or pay the cost. Get the particle sizes and see if you have the larger or smaller. Here's another study entitled Very Low Carb and Ketogenic Diets and the Cardiometabolic Risk. And I just wanted to show this graph, which shows that with the low carb or keto diet, you'll absolutely have weight loss. You'll absolutely reduce your blood sugar. You'll reduce your triglycerides, which is part of the metabolic syndrome. That's what you want to do. And that'll also, they don't mention it here, but you'll increase your good cholesterol or HDL. And you may or may not see a change in your serum LDL. But again, if it's just the total LDL, it doesn't really matter, because we need to distinguish between small and large. And whenever you do a keto diet, when you look at the science, it always shows that the small LDL particles are reduced and the large particles are increased. So it's actually not causing the harm that people worry about. You now know that saturated fat's not a big issue. You shouldn't be afraid of animal protein because, again, it doesn't raise your blood sugar and cause that hyperinsulinemia. And these cardioprotective foods that they're mentioning, like fruit, whole grains, beans, legumes, those are the things that raise your blood sugar. So those are the things that I don't really care that that's not in your diet, because as a diabetic, it's only going to raise your sugar. So let's talk about what the takeaway is for this video. Number one, you need to trust your common sense, right? What I just shared with you should be fairly common sense. If something raises your blood sugar, that's not something that I want to consume, because I don't want to be diabetic, and I certainly don't want to have a high blood pressure. Number two, if you have access to a glucose meter, you should trust that. So if you consume some of those high carb foods like the brown rice and you see your sugar spike, then you know that you can trust that that's not good for you. So trust the numbers from that meter. If you don't have a meter, try to get access to one if you're not diabetic. Don't be afraid to question the dietary guidelines. Don't be afraid to question U.S. News and World Report, because they're using expert opinion, and you should not trust experts as much as the science, right? So when you think about it, right, if you think about the food plate, they recommend grains and fruit, right? So if that's true and you're a diabetic, is that the best option for you? And I would argue the answer is no. So don't rely on the expert opinions, rely on the science. And finally, um, if you don't find success with a low carb or keto diet, in terms of better blood sugars, better blood pressure control, then maybe, just maybe, there's other causes. So I would then ask you to talk to your clinician about obstructive sleep apnea, renal artery stenosis, other renal diseases, primary aldosteronism, pheochromocytoma, and Cushing syndrome, aortic coarctation, and then various thyroid conditions. So those are the things that I want you to be thinking about. I hope that you can walk away from this video knowing that, yes, I hadn't thought about hypertension this way, but it looks like I have a sugar problem, not a salt problem. And there's no such thing as a medication deficiency. So once you heal, reduce the inflammation, make your lifestyle changes, it's very likely that you will be getting weaned off your medicine in the future. So I hope this video added value. If you know anybody who needs to hear this message, make sure you share this video with them. I really appreciate you coming to my channel as we all are working to achieve metabolic health. And until the next video, be safe, be well, and continue to protect your nest.